Let's talk about the fight against COVID-19. Well, we saw, we had many conversations, especially last year, with regards to the plight of healthcare workers who have been identified, and everybody agrees globally that when it comes to fighting this pandemic, they are the frontline workers. And we're talking about all healthcare workers, all cadres, whether doctors, pharmacists, dentists, clinical officers, lab technicians, everybody who works in a health facility, including the cleaners, those in the kitchen, those offering security. Everybody, regardless of what service they're offering, is in the front line. And then we saw issues of even doctors downing their tools at some point, clinical officers as well doing the same, and lab technicians also threatening to do the same.
Yep.
Why? Because of payment, because of being taken care of. Or are they getting proper remuneration for the work that they were doing, extra hours? Were they getting the support that they required? For example, getting the protective equipment that they needed, getting medical cover that would help them. There was a very sad case of the much publicized case of the doctor who died, who used to work at Machakos and ended up dying, and he had to be taken to a small health facility, not even in a public one, and where he passed on. And the issue of the plight of healthcare workers was basically brought to the fore once again by this particular death.
Yeah, I mean, even as I hear you say it, we talk about it, but then we thought, I think the assumption was that things had gotten better, and that healthcare workers, doctors and such who had not been paid on a regular basis, that this had now been regularized. But it would appear that it is not the case. We also had the whole conversation about whether healthcare workers were getting the COVID jab. And then we come back to the place whereby healthcare workers are not being paid. Now, this is what you expect when you hear the counties complaining that they don't have enough money or that they have not received the allocation that they should have on a monthly basis. So you would not be surprised that healthcare workers fall into now this lot of folks who also have not been receiving their pay, because counties who essentially pay them also have not received the money that they should be receiving, and so then they're in arrears. So this is when we look at county governments, devolution not happening in the manner in which it should be happening. Then you have some of the most vulnerable in society then also taking a hit. This is what you would expect to happen. You would think that counties are not getting money, and so therefore counties are not getting money. Okay, counties are not getting money, then guess what? Certain operations then cannot happen.
Yep.
Your healthcare workers are not being paid. Then you risk the threat of healthcare workers not then attending to their patients. And then people get sick, and then people die. The domino effect cannot be ignored. This is what's happening right now.
So a number of tweets went viral last week by doctors and healthcare workers talking about them not receiving a salary. And I saw this going viral, and I asked myself, okay, so I'm seeing this from a doctor. I haven't seen this from any other cadre of workers in county government. Is this cutting across? Or are we saying that everybody is not being paid, but those who are vocal enough are just the doctors? Or only doctors are not receiving their pay and the others are receiving their pay? Because why is it that we're only seeing doctors talking every time the issue about pay? Now it's doctors. Let's bring in the spokesperson of all the doctors in the country, the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union. He is Dr. Davji Bimji Atellah. Good morning, Dr. Ari. Welcome to the Situation Room, Doc. Good to have you on the show.
Thank you so much.
Well, the last time we spoke to you, you were a branch leader in the union. Now you're a national leader in the union. So congratulations on that.
Thank you so much, John.
This is Eric.
This is Eric Latif and my colleague Nduoko here. Yes. So let's just get straight to this point. Have doctors been receiving their pay in the counties in the last 4, 5, 6 months this year?
Okay, the situation actually is different from different counties, and the reality is that most of the counties have a poor governance and have not been paying doctors. I want to just take a sample of a few of the counties. We have counties like Murang'a County, we have counties like Taita Taveta, counties like Laikipia, counties like Homa Bay, and counties like Machakos. have gone some up to 7 months, like Machakos, some up to 3 months, some up to 2 months without paying doctors their salaries. And this delay, I saw the Council of Governors, the person in charge of finance, Dr. Ndeutu Muredi, saying that it is because of the exchequer. But I don't think that is true. The major reason why these counties are not paying the doctors and the healthcare workers or the employees is because of the poor governance and the poor management of funds in those counties. And there is a direct ramification of not paying those salaries, because once that is not done, there are also statutory deductions. That is like NHIF, KRA, and even the loans are not paid during the time that they don't pay the salaries. And we saw in many places, the doctors go to the hospital to get services, and they're not able to be given those services because the NHIF are not able to cover them. And this case in particular, we saw a specialist in Muranga who was detained in the hospital in Mpisha for more than 3 days because the NHIF was saying the county government of Muranga had not remitted the dues for a period of more than 4 months. So this case of counties not paying salary is quite common, and it's not something that is auguring well with the welfare of healthcare workers. At the same time, these people who have not been paid salaries are expected to wake up every day in the morning and offer services to wananchi or to the Kenyans in the hospitals. So this is actually a very bad situation.
Are you saying essentially, Doc, that there is a lack of will to then pay health workers, to pay doctors, even if the money does exist?
I'm saying this money does exist because I want to give you an example. As you said, I was previously the branch secretary for Southridge, where in 2015, 2016, 2017, there were issues in Nakuru County where every month doctors were on boycott or were on strikes because there were no salaries. But when the government of the day was changed to the new government from December 2017 to date, there has not been salary delay. There have been salaries are being paid every month. So there's no way one county will be paying salaries on time, and then the rest of the counties will be saying that they're waiting for funds to pay the salaries. So it's a fact that even as we speak, doctors in Muranga have not received salary for 2 months. As we speak, doctors in Taita Taveta have been going to the bank waiting for overdrafts that the county promised that they'll pay the salaries. And as we speak now, we have so many doctors who are receiving notifications from the banks because of the unpaid loans and unpaid deductions. So it's a fact. The counties have not been remitting and have not been paying the salaries.
Does this only apply to healthcare workers, or does it apply to all workers in the county?
The way devolution came about, a bigger chunk of the workers in the counties are healthcare workers. And as you see, I think they form about more than 50% of the workers in the counties, the healthcare workers, because of the devolution. So the people who will feel the heat or the heat of salary delays are actually the healthcare workers, because they are in the counties. For example, somebody lives and works in Muranga. They have livelihood dependent in Muranga. So when they're there, the 2 months no salaries, they have to speak. Their voice has to be heard. So it's healthcare workers that are heard mostly because they're the most devolved in the new constitution.
Okay, so I'll ask the question again. Is it that all workers have not been paid? For example, in Muranga, when you say there's 2 months arrears, is it 2 months arrears for all workers, or is it 2 months arrears for only healthcare workers?
It should be. It's 2 months arrears for all the workers in the county.
So you said, for example, you given an example, Muranga, 2 months. Was it Machakos that you said 7 months?
Yeah, Machakos has been involving doctors. In Machakos, it's particularly only doctors in Machakos.
Okay.
Because Machakos has a big shortage of doctors, and it's been engaging doctors on contractual terms and some on locum terms. So we have a number of doctors that were engaged 7 months ago, and they've been working diligently and offering services in the Machakos Referral Hospital and other facilities, but up to date, they have not been paid any money for any month. We also have the doctors who are working under UHC, who are working in COVID centers, who have worked whose contracts were renewed by the Ministry of Health. For the last 5 months, they have not been paid.
You see, the reason I'm asking this is because of what you've just brought out. There are some doctors who are working in the counties, but they're supposed to be paid under the UHC, which is a national initiative.
Yes.
And then there are those doctors who've been contracted by the counties on, a contractual basis or on locum, like you said. And then there are those who are permanently employed, hired by the County Public Service Board.
Yes.
So does it cut across in all these counties that you've given examples of, Homa Bay, Machakos, Laikipia, Taita Taveta, Murang'a, and the other counties, that all workers are not receiving a salary, or is it some delay for some specific group of people who turn out to be doctors?
Okay, there are situations like in Murang'a where all the workers have not been paid, and there are Murang'a and Taita Taveta. Then there are situations where the doctors who are on contract terms or on locums who have not been paid for the periods that have been working. And there are also a particular number of doctors who are working under UHC, which is a national project, MOH project, who also have not been paid. And this is not a small figure. That those doctors, for example, those ones in MOH are over 200 doctors.
Yeah.
Yes.
Okay.
And therefore, we are saying that the ramification of this is that those who are not able to afford even the health care that they're offering or the services they're offering to the citizens.
Okay. So when we're looking at the situation also, so at the same time, we also see that there are problems at the county level in terms of receiving money from National Treasury. There has been that issue. It's been public. It's not been hidden. So can that be looked at or taken into consideration that it is currently a national issue? Just the other day, then we saw that funds were going to be released to counties, but it would take care of arrears, and we're not even looking at a present situation whereby then they're able to pay. Will it not be taken into consideration that it is not necessarily targeting health workers and doctors, but that we're looking at an entire county that is suffering as a result of non-remittance of funds from the national government, from National Treasury? Not that health workers specifically have not been paid, but that the county as a whole has not received money. So nobody has then received money because of this delay.
My concern with that's actually a fact that there are delays from national to counties. But somebody will ask that, why is it that not all the 47 counties suffer the same situation? Because you realize that majority of the counties will be paying salaries on time, regardless of the remittance compared to the others. There are a number of times that this has been happening, not only when there's this delay. For example, we saw last year the doctors in Mombasa going on strike because the banks were giving them notifications because of the delay of payments of the loans. This was not because there was no remittance from the national. Majority of the counties happened because of the poor budgeting and diversion of funds which are meant to pay the healthcare workers or pay workers to other activities within the counties.
Do we see this replaying with the same counties across the last 2 years, for example? Like, could we say that these counties that you're giving an example of have become notorious from the beginning, from, let's say, the beginning of last year, when it comes to the issue of delay of payments of salaries? You can tell for a fact that this county is going to be among the list. Or are there some counties that are just emerging now and coming up as issues of concern, while others were concerned last year and now they are doing much better in terms of paying and remittance?
I think when we look at, because there are times when many of the counties are involved and there are times that not many as such are involved. But there's one thing that is very clear that I keep on checking. If you look at the years I've told you, in 2016, 17, 15, 16, 17, there's a particular county, that's Nakuru, that was not paying salaries on time every month. But then when there was change of leadership and governance in that county, there's no single time in 3 years that salaries have delayed. That means it actually comes down to the same other counties that have been having these delays. For example, this is not only the salaries. There are some counties which have also not been remitting this certain reduction for a period of more than a year. Some up to 2 years.
Okay. Now, obviously, this is something that is not just coming from your desk, but that from what you're saying, that is felt then from county to county. Now, what is the form of recourse here to say that can we do something about this? Who has been approached? What would they say is from what you're saying, is more than not just having, it's more than just not having money or not having funds, but it goes beyond that. So who's addressing this issue? Taking into consideration that under your administration, it's not the first time that we've heard about this. We've heard this under the previous administration, the previous Secretary General, the one before that. What can be done about this situation?
I think it's a high time that the leadership of the counties really tend to recognize the value of having the healthcare workers and actually they are taking care of their welfare. Because when we have healthcare workers working without their salaries, working without the health cover, that is because they have not remitted certain deductions, it also affects their mental states. So generally, our action as a union is, first of all, to involve the society, because through that, we managed to change what was happening in Nakuru by changing the leadership. And therefore, we have a plan to involve the society to change the leadership of these counties that are continuously failing. Number two, we are trying to involve the ministry and also the treasury and the parliamentary organs to ensure that the funds that are released to the county meant for workers actually going to the workers. The other thing, we have been agitating and advocating for Health Service Commission, because with that, we are very sure that there will be no 47 centers of power that will be one day emotional and not pay salaries, and the next day divert the funds, and the next day pay the salaries. Yes.
The issue of leadership, and you started off with this issue of leadership, and you're still maintaining that leadership at the specific counties is playing a big part in what we are seeing in terms of remittances and payments. But is it just because of leadership, or are there other factors that are coming into play? For example, you said Nakuru, in the previous administration, there was notoriety. In the current administration, there is remarkable difference in terms of payment. But then Murang'a has had the same governor for 2 terms. Homa Bay, Machakos, same governors for 2 terms. Taita Taveta and Laikipia are the ones that have a different administration. Give me how it looked like in the first term for these ones that have same governor, and how it looked like for the first time for these ones that have a second governor, so that you can clearly demonstrate that leadership is the issue here.
You know, we are almost into an electioneering period, so most of the first-time governors would actually work to ensure that they retain the seats. But then also those governors who were in their first term, during the first term, they were working to retain the seats or to be re-elected during the election of 2017. And the places where we have big problems, like in Homa Bay County, where healthcare, we can say, is not working completely, and in Murang'a, where there's been big, serious issues, and these are governors who are exiting their positions in the coming election. So most of them are really not concerned or concentrating on the issues pertaining to the welfare of their counties per se. So I will say that if and when we have governors and leaders who are working to the end, then we won't be having the situation that we have of non-payment and non-remittance of both the salaries and the dues for the NHIS.
What conversation have you had with the Ministry of Health at the national level with regards to the plight of the over 200 workers who are under the UHC who were hired specifically to address COVID-19?
We have written to the ministry regarding this, and then we are hoping to have a meeting with them to discuss this, because the last time we reached out, they told us that they were in the process of paying these salaries, which up to last week, the same doctors were reporting that they have not received the salaries.
Okay. I want to shift gears just a little bit. When we saw that the vaccines had come in, there was a little bit of hesitancy, especially on the part of health workers, to be able to then get the vaccine. What's the situation like now?
Now I think more of the healthcare workers are ready and actually going to take the vaccines. And we saw like 2 weeks ago, when there were no vaccines at different facilities, they were informing the office of the union that they will go to like Bagati, they will go to KNH, and then that's after receiving communications from the Ministry of Health and not find the vaccines. So I think now there's more acceptance, and there's more of them are moving out to the institutions to get the vaccines. And therefore, we are actually hoping that the vaccines that are being brought will be enough. They will not run out like it happened a week ago.
What would you say has contributed to this change of heart by the doctors and the healthcare workers? From initial hesitancy to now accepting and willing to go and get the jabs?
I believe that there's been different studies that have been coming out regarding the vaccines. And for the first time that the vaccines were rolled out, there was a rather scare that the AstraZeneca vaccine could cause thrombosis or the deep vein thrombosis. So that caused a lot of fear among the people. But then that became a rumor. So with those clearing of rumors and with the studies that have been ongoing, it's clear that there's protection from the vaccine, and many of the healthcare workers are actually taking it up.
Well, we've also seen, when still staying on the issue of vaccine, the vaccine rollout. So the country initially received 1 million plus doses of vaccine. And then recently we've been getting these donations that are coming in. From where you sit as a union and seeing the vaccine rollout, the efforts that the government is taking to secure and acquire vaccines and then roll them out, how would you rate the government? Do you think they're doing the best they can? Do you think this fight against vaccine is something that we should be pinning on the government or somebody else?
I think the government is doing extremely poor in terms of rollout of the vaccine, because as we know, the ultimate way to combat the virus will be by vaccinating the population. About in 6 to 8 months since the vaccine came out, only 1% of the Kenyans have been vaccinated, or rather 0.7% of the Kenyans. So for us to open up the economy and to stop using the masks and to have everything running normally, then we need to vaccinate about 50% or more of the population. But up to now, only 1% have been vaccinated. We see that the vaccines that have been in the country are mostly from the Covishield and the donations. So the government has not really put up money and buy the vaccines also to beef or to vaccinate the population, which is a need to do that.
Okay.
Do you think what we've seen internationally playing out, the fact that there are some countries that are hoarding the vaccines, some countries that went and bought out almost a year's supply or capacity of the manufacturers, do you think this is playing a role, and do you suppose that could also pass as one of the excuses the government could give?
Yeah, that plays a role, but again, I feel like most of those countries had earlier budgeted and planned to buy the vaccines, while we had not planned to buy. We had planned to depend on the Gavi or the Covishield. So I think if that has played a big role, but also there's another push internationally to lift the patenting of the vaccines, which would allow even the government or the country to manufacture the vaccines locally. So I think that has played a role, but also we need to actually have the funds ready and buy them.
Having a conversation in the Situation Room between Eric Latif Nduoko and Dr. Davji Bamji Atellah, Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union.
Right, so as we continue, Daktari, we're also looking at coming off the discussion of vaccines and what we hope to see in the coming months with the rollout. Also with COVID-19, we're going into a season whereby we've been told it's possible that there will be a fourth wave of COVID in the country. What do you think really must be done at this point? And then, we have people going back to normal way of life, spreader events happening around the country. What do you think needs to be done right now? And what are doctors, health workers, health practitioners feeling about the situation currently?
Yeah, thank you. I think what needs to be done, first of all, strongly, is that there's need to increase the rate of vaccination. There need to be more Kenyans vaccinated, because that's the only way and the most ultimate way to build a herd immunity, which will prevent the reinfections. But given that the country is not doing so well on that, I believe then we need also to look at our healthcare workers in the country. We have a big shortage, especially in the lake regions where we have been having a lot of surge recently. Because you look at the lake region counties where the coronavirus has been rampant in a few days, they have not employed healthcare workers for at least 5 to 6 years now. So there's a big shortage of healthcare workers in the country, and that, I believe, contributes also to the higher numbers of the coronavirus cases, because those who are already at the facilities get overwhelmed. Yes.
Okay. So, but now, there have been many messages. What would be the message coming from medical workers, from doctors in the country today? What would be the message to Kenyans? Because we look at this continually being called, an approach that has to be shared by everybody, shared by government in terms of what needs to be done. Yes, get everybody vaccinated. Shared by health workers to Kenyans. What actually needs to be done or needs to be remembered on a regular basis in terms of protection for yourself from COVID-19?
I think everyone should know, and everyone should be aware that we are still not safe, and the coronavirus is with us in the community. Everybody that you meet everywhere could be a potential spread of the virus, and that we need to, each of us, take responsibility and be cautious. And that is involved, if we have not vaccinated, they are not going to 2 doses. We need to use the masks properly. We need to have social distance. We need to take all those MOH precautions that have been given out to us. And then secondly, when we tend to have mild symptoms, we need to get medication. We need to get treatments. And this should involve to the nearest place possible that you can get the medications. And another thing, we also need to make our government to ensure that there are workers who will serve us in every facility that we go to. That's something that everyone needs to know and be aware of.
How is it right now in this Lake Region counties in terms of healthcare workers? Are the facilities full? Are the facilities able to cope with the current numbers? Are the county governments working with the healthcare workers to, work out modalities of, should this thing deteriorate, this is what we'll be able to do?
The one thing that I've seen the governors of the Lake region doing is asking to buy the vaccines by themselves, something that we as union were not proposing, but opposing strongly, because we believe that there should be steps to everything. That there's need to have healthcare workers in these particular counties, which I believe have not employed for over 5 years. Then secondly, they need to have more facilities built, because they have some facilities, but then there are no workers in them. For example, in Oma Bay County, there have been a great shortage of workers in that county.
Yep.
And then we believe also that when the counties are given chance to buy the vaccines, there's a high possibility of that money diverting to a different activity other than the vaccine. So a bigger issue in those Lake Region counties that probably may have resulted into the surge is also the poor healthcare in those counties. We have counties that have not been operational well even before the coronavirus and have just deteriorated further by the existence of the virus.
When the health ministry first issued an alert and caution around these Lake Region counties, there was talk that maybe what was going to follow next was going to be some sort of lockdown, or at least restriction of movement into and out of these counties as a block. That has not happened. Do you think that is something that ought to happen? Should there be restriction of movement into and out of, just like what we saw in Nairobi and the other 4 counties surrounding Nairobi earlier this year?
I think that for restriction has actually worked before, but where we are currently with the situation of the virus, where it is within the community and people have been moving around a lot, the ultimate best way will have been the vaccine. The ultimate way is that now within these counties, people need to have precautions. They need not to have more gatherings that are continuing to exist. So people need to take more of precautions and to the healthcare rather than just lockdowns. Because I believe when you lock most of these places and you expect those communities to be able to survive, it becomes very difficult. So we need to have a balance to have the healthcare working, and to have those who are able to be vaccinated, and also to just have every citizen to take the precautions that need to be done.
Okay, let's just be practical here, Dr. One, vaccines are not going to be in the country this week or next week. There haven't been more vaccines in the country other than the recent donations in the country. That's one. The second bit, which you're saying, is more awareness and more adherence to the measures by the people, has not been happening. And that's a practical thing. We are seeing people are going out gathering, people are meeting, people are not wearing masks the way they should. So really, are we going to be able to address this if we just look at it from the textbook that, you know what, people should do the ABCs of avoiding transmission, we should have more vaccinations? Are we going to fight this thing?
I was feeling that most of these counties, we need to have what we call public health education to the people in the counties, rather than more of a policing aspect. Because then with the public health, people will tend to have a lot of a will in taking the precautions than being forced to take the precautions. Because it's very easy for people to gather in buildings to hide from the government or from the criminal police than when they understand the reasons why they need to do that.
Don't you think people understand why they need to do that by now?
They understand, but it sometimes differ. So that's why we need more of a public health censoring than police role in the situation.
And how would the doctors and pharmacists union, for example, play a role in this? Oftentimes we've seen the role has been, oftentimes we've seen that the outcry has been against what is not happening on the side of the government. But here we are looking at a place whereby active role in making citizens aware of something that could actually or potentially affect their health. How would the union, for example, and doctors and health workers come out and say, look, Kenyans, this is about us protecting ourselves? How much more of a role could be played, for example, in making that happen?
I think as a union, as a KMPDU, we have gone out strongly in advocating and for the safety of the wananchi. We have our branch leaders, and even the county liaisons, and even the doctors working in different facilities, bringing out this information to all the patients. And they've been trying to offer the quick services at the same time advising the community and the society on the need to protect themselves and to prevent spreading corona or getting the disease. This has been happening, and we have really strongly invested in advocacy of awareness of corona. Strongly.
Okay, so then in terms of the information, if this is the case, in terms of the information that is being put out there, one of the main issues has been, I have not received my first dose. I haven't received my second dose. I've received my first, I've not received my second. Now that we're looking at vaccinations, what happens to those who didn't take the first dose? Yet, the government has made it clear that if you hadn't taken the first dose, you shouldn't go for the second one. What happens to them in terms of information that you're receiving that you can then now give out to Kenyans?
What happens is that if you have not received any doses of the virus, it means that getting severe disease and even dying from the virus is still high. But when you've gotten only the first dose, it means that your chances of getting severity of the disease is reduced up to 65%. The essence of getting the second dose is just as a booster. It boosts the immunity that has been acquired through the getting of the first dose. So sometimes I think it's better to get any dose rather than not getting any. So it's better to have a dose that you've gotten than not getting any of the doses, yes.
Okay, now this comes in actually at that critical point then. Would you advise the government to, instead of receiving any new donation and seeing how to cover the 1 million people who received the first dose, getting the second dose, but focusing on getting more and more people getting the first dose, which is better from where you sit? Getting more people into the first dose or completing the dosage for the people who received their first dose?
It depends on the type of the vaccine that the country has been getting. That is the AstraZeneca. So the called the efficacy of the virus also is boosted by getting the second dose for this AstraZeneca vaccine. And that's why it's important that if you get a first dose, from the 65% prevention that you get to the 99% coverage, I think it's better to get a second dose.
Okay.
But ideally, the government needs to buy more vaccines and to bring more vaccines to vaccinate more Kenyans.
Dr. Davji, there's the issue of corruption, and corruption has actually been called the other pandemic, and it happens around the country. If I were to ask you, how is corruption hampering the access to healthcare for the citizens of Kenya, from where you sit as a union?
I think it is the biggest headache and the biggest issue where the healthcare has failed even in the counties. Because, and I've said this before, that I believe that the county governments are corrupt strongly. And not only county government, but even the ministries. You know, the Constitution did not envision flamboyant governance. From the Constitution 2010, there was governors who were going to be like the DCs, because those are the units that were operating at the time. But given that there was no financial policy, financial structure, then the allocation that are going to the counties as a whole, a bigger chunk that remains in the office of the governor, makes it difficult even for the normal operations in the county, like the paying of salaries, to take place. And ideally, I want to give you a practical example of what happened a few days ago, where a doctor, a specialist in Murang'a County, is admitted to a hospital, and the day of discharge is a hospital bill could not be paid by NHIF. And therefore, we called the county government, the CEC Health, the Chief Officer Health, and even got into connection with the NHIF CEO.
Okay.
But since the county had not remitted 4 months, the NHIF CEO could not trust that these monies will be remitted so that this bill of the doctor could be cleared. And we had to collect funds to pay for the doctor's fee. So it's a clear thing that I believe the corruption is a major thing that is causing all the deterioration in the healthcare in this country.
So corruption is the real pandemic.
It's the real pandemic.
We've talked about fighting corruption for so many years in this country. We set up KACC, KACA, EACC, and all these organizations, and even having ministries come up with anti-corruption slogans and having people in the office saying we are fighting corruption. But it seems not to be making any headway. How do we address corruption so that then we can ensure that the citizens of the country are enjoying the benefits that they should be getting from their government?
I always believe that the evil of corruption is both the giver and the receiver. And some of these corruptions are not even in terms of giving and receiving. Some of them are implied. For example, we look at counties like Laikipia, which irregularly dismissed doctors over a year ago, but have been budgeting for the same doctors. We have the Public Service Commission reinstating the doctors. We have court orders reinstating the same doctors. So you realize if doctors, 34 of them, earning over 200 million, has not been given to them over the years, where has this money gone to? I believe that is corruption. We have counties that are deducting certain reductions from the loans of the doctors' payslips. That those who are deducting union dues for over 2 years, and they're not remitting the finances to the institution that they're supposed to remit, while the same finances are not with them in the counties. I believe those are pure corruption. So basically, I think each of us needs to take action against the county governments and against the individuals in any of the ministries who are involved in the corruption. And number one, the best thing to do is that anyone who is involved in corruption or been mentioned should not be elected into office.
What would this action look like, Doc? What this action that you say must be taken against the counties, what would this action look like? Because, like I said, these are perennial issues. They did not start now in 2021. They've been there 10 years in the running, right? Or more. Yeah. What would this action look like that would yield the kind of results that we're looking at, where we say, rid this area of this corruption, so that we can actually see healthcare then being delivered to the citizens of this country in the manner in which it ought to be? What would the action look like? Because I can be sure that, as you say, that there's corruption in the counties when as concerns health, that you then know the individuals These individuals are known. You know what they do. You know how it's being done. It's very difficult to be a whistleblower, as it were, right now. What would the action look like?
I think there are two multi-pronged approaches to this issue. Number one, I've seen, for example, in Laikipia particularly, where the residents of the county are asking the president to dissolve the county. Like they're tired of dying, they're tired of not getting health services. So that's a situation whereby the society, the societal power, have decided to take an action against a regime which is not working. This happens when 2 to 3 court orders have occurred and have not been obeyed by the government. So that's the first approach. The society needs to be empowered and understand the issues pertaining to why they're not getting the health care and they're not getting the services as they should get because they're voters. Number two, we need to look at the courts. The courts need to be able to work. When issues are brought up in courts regarding abuse of office or regarding non-operational institutions, then the decisions of the court need to be enforced, because most of these governors and most of the institutions, once the orders are out, they disobey the orders and nothing happens, which is equal to anarchy. The other thing is that we need to ensure that as unions, institutions like the unions and other organizations, when we see or suspect or assume that there is an element of corruption, there are elements of indignity, we need to speak out against it, and we need to report the same. And then when we report to our bodies, we need to follow up with the bodies. I believe previously, as the DCI started, most of the things were being followed up. But of recent thing, we have seen a bit more of delay in that. But there need to be the way the DCI used to operate, where the issues are brought up and the issues are solved. Because many of the governors, I'm telling you, if they're followed up, you realize the scandals that have undergone through the years is what is making people die without better health care.
Citizen action, like you say, is very, very important, and I agree with you. But there's a journey that needs to take place so that then the citizens, like you said, are empowered and sensitized, and they see what action they can take. What role does a union such as yours play in that particular issue? Because you need to be the ones that translate that picture to us. Tell us the reason why you are not getting the health care that you deserve is because of the failure by the government. And this is what you can do to have that addressed.
You know, previously, in many of the months and years, we've been seen as a striking union.
Yes.
But one of the things that we have promised, one of the things that we promised as we were taking office is to reduce the number of strikes, because we wanted justice to be done to both the workers and to both the Kenyans. And for this to happen, we must sit down and get down to the roots, down the ground, to the bottom of every place. We have to meet with the border members and discuss with them that as much as we want healthcare, better healthcare, quality healthcare in these counties, we only have 10 doctors among the population of 300 residents here. And for this to happen, there's need to employ more doctors. And these doctors are not going to treat other doctors, but they're going to treat you as border rider. They're going to treat you as a person, as a resident of this region. So with that understanding, you tell the residents, you have been in the host line for 2 days and have not been treated, not because the doctors don't want to treat you, but because there are no doctors in that county. You have been referred from your hospital to KNH or to MTRH, not because the condition you have cannot be treated. So this has to be put in a language that every resident of a region understands. And once that happens, then they will know that the failure of them not getting the healthcare, the failure of things not happening in the county is not because of the healthcare workers, but it's because of the county government of the day.
That's very true. And as we conclude the conversation, Dr. Davji Benji, there's the issue of malaria, which is also another constant in the country, and it's a big killer in the country. The people who are listening to you today, as an expert in this, how are we in terms of fighting malaria really on the ground? Because the government keeps giving us all these figures all the time, our progress in the fight against malaria. But as a healthcare worker and healthcare workers around the country, are we really getting making good progress in the fight against malaria?
malaria is a disease that has been long in country. The tropical disease that has been long in the country, and we see most of the developed country have actually fully eradicated the disease. And because there are very many aspects in which this can be done, by even sterilizing the vectors that spread it, by ensuring that at least everybody have the nets, and by ensuring that things are actually working in different places. But as I say every time, there's always problem within the counties that this perennial occurrence of these issues. For example, the Nandi County. And Nandi County has been having an outbreak of malaria year in, year out. We have the MCAs in that county, we have the members of parliament from that county, we have the governor, and we have the county government who get allocation of funds in big chunks. But you realize that there is no single plan over the 5 years that these governors have been in the office that they've planned for a way to eradicate or to plan to do something against this particular malaria. Same to the whole country. And I will tell you that's what has brought the failures in most of the places. So the best way is that we need to have the government that's responsible for issues that are affecting the citizens.
That's very
Last
true.
example I want to give you is that you look at where I keep on referring to governors have failed. The president has these 4 agendas, the 4 agendas, which one of them is health. It doesn't have direct responsibility to the counties. And you could see Nairobi County having failed under Evans Kidero and having failed under Sonko. When Nairobi County was put under the governor, under the
NMS.
general to be NMS, in 1 year, Nairobi County has built 24 level 3 and level 4 hospitals, and not just build them, but has employed 200 doctors and other healthcare workers to work in the same place. This shows that in case, and this has not costed much, because I realized that the 24 level 3 and level 4 hospitals that were built costed the county, the NMS, 874 million.
It's true.
And the things and the employment.
I want to interrupt you here, but good example that you've given, Dr. Davji Bimji. Thank you very much for joining us today. We've run out of time. Dr. Davji Bimji Atellah, Secretary General, KMPDU. Have a lovely day, Doc.
Thank you.
Thank you.